Hello, Enrique. So you will be our first speaker because we know that you have a flight to catch. So let me introduce you, and the floor is yours. Enrique Martins is an associate.
Thank you very much.
Thank you. Good morning. So, Henrique Martins is an associate professor in health management and leadership at FCS-UBI, which is the Faculty of Health Sciences in the University of Beira in Portugal, and also is at the University Institute of Lisbon and in the board of directors of HRC Europe. So, Enrique, the floor is yours.
Thank you very much. And it's a pleasure to participate in the first Greek Forum on Cancer. And I'm really sorry I'm not there. I normally like to be in Greece, in Athens, but can't make it today. So I'll be sharing some slides very quickly, some ideas about European Health Data Space, your exchange format, and one or two thoughts to provoke the discussion. Just share my slides over here. So basically, what I would like to share with all is, first of all, very quickly tell you a little bit about the exchange, the Expand project. You can know more about it on our website. And it's basically a coordination support action aiming to promote one of the aspects of the European Health Data Space, which is the exchange format. Basically, it's a very large consortium with multiple partners, some of which are from Greece, and we are increasing the participation of partners and opening up, trying to engage more partners as we move through, especially with our Greek colleagues. I want to remind you that we have started a journey of cross-border services even before the European Health Data Space, but it's good to know what is the big difference. The biggest difference is that so far, before the regulation, these were voluntary participation. So you see Greece is also joining and making important efforts, but also other countries have done so. But this was a voluntary approach. Right now, with the regulation, we want to make it compulsory, so we want to make it available for everyone. And this is a slide just to remind us of an example of any citizen flying to another country where you can get your e-prescription. So I'm sure all Greeks are familiar with the concept of electronic prescription. It's very well disseminated in Greece, as well as it is in other countries. And it's not just Finnish people or Swedish people or Portuguese people going into Athens for vacation and dispensing medication. It's also Greek people flying out and needing to continue to use their medication. So this is, of course, important. But to be honest, this is just the beginning of a very long work we need to do together. Because, for example, for cancer patients, many of the prescriptions they need are hospital-based. So they're not really part of this service, and this is something we need to improve in the coming years. Now, what is the exchange format in a very simplified manner? It is a sort of a way to organize information. Imagine a music file that you have on your iPod or iPhone, and you want to transfer that file to another system, another computer, and it still works, still produces music, right? So it's a similar thing, but for electronic health record exchange format is the information about your health. So it is a set of requirements and technical specifications that help programmers, help companies, help IT development companies to organize information in a way that patients and professionals, they don't need to worry about this. When people ask me, well, why would patients need to know this? Well, they need to know that it is this type of work, it is the exchange format type of work that will one day make data from a hospital in Greece transferable to a hospital in Portugal, in the case a Greek citizen moves and needs to continue to take care of his disease, his chronic condition, or in the middle of a treatment, cancer or any other thing. It's also the format, so it's also the way the systems are connected for connecting not just the electronic health record systems of hospitals or primary care facilities, but also other digital applications, including medical devices. So the European Health Data Space has two main areas, primary use and secondary use. And this is where my critique starts today, is that it is divided into these two types of use. Primary use, it's the situation where you go to your doctor, you go to your nurse, and he does something to you, and it gets recorded into the electronic system. Secondary use is about reusing of health data, picking up that information from different systems and using it to share data for healthcare, for research and policy making, and even for AI use. Now, why would I like you to think differently? So I bring you two ideas that I want you to discuss over the next days. One is this idea of people-centric value for data. The digital patient, the patients are going to be our focus of integration. But for patients to be able to do self-managed, self-care, and contribute to the continuity of care and treatment, which is the top of this pyramid that I'm showing you, using health data to cope with your everyday life challenges. Because inevitably, we all will have diseases. So, of course, we want to use health data to prevent and to promote better health. But sooner or later, we all have medical conditions. And at that point, we want to use data to live better, even with those chronic conditions or cancer conditions. So this pyramid is a work that me and Anwan and Catherine Kronaki from Crete and Giovanna, so we came up with this idea that first we need access to an accumulation of personal health data. So if you imagine, for example, the Greek ecosystem, your IDICA app, or you would like to have all your health data accessible in that app or in a portal, right? You want to be able to accumulate personal health data, and then you want to be able to curate, so edit, delete eventually some of the data, and control, allow people to access the data that it is yours, but for their own works, for their own research. Sorry for the background noise, I will speak louder. And then finally, the second idea is about circular use of health data. So if it is true that we collate data from everyday encounters with doctors and nurses and other professionals with prescription, it is also true that that data can be stored in a centralized repository. But we need to think that that data is going to be useful to build insights into AI-based tools that need this population or subpopulation data. And this will then generate new suggestions for the next appointments, medical decisions. So next time you go to your doctor, next time you go to your oncologist, next time you go to your nurse, whatever, you would want the electronic health record system to be better designed and even suggest actions in terms of patient pathways. And this is a form of tertiary use. So AI that combines populational data with your personal data to give insights about you as a patient is a form of what I call tertiary use, or you can imagine it is primary use again. In this sense, it is circular use, because in your next appointment or in any decision-making point, that a new decision, let's suppose, adjust the medication, adjust treatment plan, the doctor, the clinical decision maker is going to benefit from insights that have been produced by combining data from many patients with similar conditions. So I want to invite you to discuss this topic of circular use of health data, something that I think is new and is not well covered in this regulation. But if we combine the AI Act, which is future coming in Europe, with the European Health Data Space, then we can do this. Now, just one last minute. So Expand the Age is about also co-creation and expanding the ecosystem. So activities such as this forum where discussions with patients about digital health are happening are really important. We will have the second expert summit in Brussels, November this year, and you're welcome to fly over to Brussels if you manage to and participate. We have designed the XNets, networks of associations, for example, associations of patients, but also associations of citizens in society and others, to discuss these topics. So please feel free to engage with our project. And if you know of a patient association, another one, not the one organizing the event, who is already on our XNet for patient associations, but others, please invite them to come. And then if you want to be part of a community of doers, you can join online our community of doers. And this is a community of patients, programmers, and professionals. So programmers being IT developers, healthcare professionals, doctors, nurses, and patients, to discuss, but also to come and join in terms of the, you can scan the QR code and you can go to the Community of Doers webpage and put your name to that. We've done 2 workshops already, one in Italy, one in Beira last week, where we started developing the idea of new types of e-prescription, e-dispensation, and electronic patient information with people in the room that were programmers, health professionals, and patients. So we want to engage patients as creators of the European electronic health record exchange format. And of course, today, I wanted to leave you with this concept of circular use of health data. So thank you very much, and do keep following the project on social media, and I'm happy to answer questions at a later stage by email. Thank you so much for giving me the opportunity of sharing some ideas today.
Henrique, we thank you so much as well, especially because you managed to mention so many ideas and so many concepts in such little time. And especially thanks for mentioning the digital patient and introducing the idea of the personal health data space, and for the circular use, because circularity is a very powerful word. Thank you very much.